what is influenza? Influenza is a viral infection that typically comes in the winter months, and again, it can be spread by coughing or sneezing or onto someone, touching the eye, spreading that way. The symptoms tend to be fever, sore throat, cough. It also can have body aches, chills, headache, and in this new H1N1 virus that we're talking a lot about, you'll also see sometimes vomiting and diarrhea. This virus we're calling a new virus because it's an influenza-type virus that people don't have experience with. We haven't seen this in the world before. So if people want to prevent the spread of influenza or flu, what you can do is cover your sneeze or cough. If you don't have a tissue, you can cough or sneeze in your sleeve or use a tissue and then throw that tissue away. And then for sure, after that, wash your hands really well with soap and water or use one of the alcohol-based hand sanitizers. The other thing we want to do is make sure we don't touch our eyes, nose, or mouth unless we've just washed our hands, because this virus, influenza virus, can live on things, even for more than 8 hours. And so if there's a germ on there and you touch it and then touch your eye, you can actually get influenza that way. So covering your cough, washing your hands, not touching your face, those are all great ways to prevent getting influenza. Okay, let's talk about influenza vaccines. Influenza vaccine is the very best way to prevent getting influenza. Influenza vaccine comes in 2 different ways. One is in a shot or an injection in your arm. People who need to get that would be people who have chronic conditions, underlying health problems, pregnant women. And the other way that is available is through the nose in an intranasal fine mist. People who can get that are those who are 2 years and older, up through 49 years of age, who are otherwise healthy, not pregnant, and don't have any problems with asthma, for example. Both of them are very effective, both of them are safe, and both of them prevent influenza. Sometimes people wonder about the safety of vaccines. And we know that the injectable vaccine can cause some redness, soreness, tenderness in the arm for a day or 2. The nasal type can cause a little bit of maybe runny nose, perhaps sore throat for a day or 2. Both of those are mild and nothing compared to what it would be like if you got influenza disease. In that case, the disease makes you very, very sick for a number of days. The new H1N1 vaccine should be available to us later this fall, and that would be a separate vaccine from the seasonal influenza vaccine. So there should be enough vaccine of both seasonal and H1N1 for all Americans. It won't all be ready all at one time. So there are some people who should get the vaccine first. The H1N1 vaccine should go to pregnant women, healthcare workers, people with chronic conditions, and those children 2 to 24 years of age. Both vaccines will help be our best way to prevent influenza. There's a group of children who really should come to the emergency room to be checked if they have influenza. These are kids who are having difficulty breathing. They're breathing fast, they have chest pain, or they look bad. They look like a rag doll, or they look kind of lethargic, or maybe they're agitated and seem like they can't get enough air in. The children who have difficulty urinating, if they haven't gone to the bathroom for 8 to 12 hours, if their mouth is dry and they look like dehydration is setting in, those children should come to the emergency room. Children who have high fever that is not able to be controlled with Tylenol or high pain amounts of pain should come to the emergency room. And if you're concerned at all and not know what to do, calling your clinic or even calling 911 is the right thing to do. But please reserve the emergency room for children with emergent problems. What we don't want to have is have a mildly ill person come to the emergency room and actually pick up an infectious disease while they're here in the emergency room. So any questions you have, feel free to call your clinic.
You can always find more resources on Children's Hospital Movement website. Just log on to childrensms.org.